अस्सलाम वालेकुम, इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज से एसके सीरीज़ का मेडिसिन का मैं पोर्शन स्टार्ट करने जा रहा हूँ। एसके 16 मेडिसिन 21 February आफ्टरनून पेपर। क्वेश्चन नंबर 1, an elderly patient suffering from the constipation on and off and as a result of straining, what exactly she is doing that helps her to pass the stool, that is the laxation of puborectalis. Question number 2, a neutropenic hypotensive patient admitted in the oncology ward with a history of dysuria, high grade fever, blood culture yielded the growth of Pseudomonas aeruginosa. These findings suggest that the disease is the result of the excessive release of the product, that is the TNF. Question number 3, the female with a pH of 7.5, hypokalemia, normal sodium and the normal cortisol but raised renal levels, that is alpha renal artery stenosis. Question number 4, which of the following drug is a pro-carcinogen alpha, that is cyclophosphamide. Question number 5, an IV drug user most common in world organism will cause what infections, that is delta infective endocarditis. Question number 6, the slow waves of stomach begins from the interstitial cells of the Kegel. Question number 7, REM sleep related to Charlie the cholinergic system. Next, question number 8, a patient non-smoker, fever for the 6 weeks and cough with a small amount of the blood on X-ray coin lesion is seen in the upper lobe. It is related to the granulomas. Question number 9, a patient injured in the RTA, bleeding from the site of injury with the BP of 90-70, heart rate increase from the 100 and 100 from sitting to standing to 120 due to alpha decrease in the venous return. Question number 10, a patient's ECG shows prolonged PR, echocardiography shows no ventricular hypertrophy, left axis deviation seen. This is which block? That is Charlie the trifascicular block. Next, question number 11, the pellagra is caused by the deficiency of the niacin 12. Lactation during the pregnancy is inhibited by delta estrogen. 13, which of the following feature is common to pheochromocytoma and the Cohn syndrome? Charlie the hypertension. 14, the strongest stimuli for the erythropoietin or alpha, that is hypoxia. Question number 15, the patient with the color blindness can differentiate between the red and green. This is the protonopia. Question number 16, which of the following directly controls the autonomic reflex system of the body? Beta, that is hypothalamus. 17, angiogenesis in the wound healing is done by which of the following? That is beta, VEGF. 18, the patient experiences stress of hospitalization due to Charlie fear of being handicapped. Question number 19, a patient after CVA has loss of appetite to food and drink and tendency to throw. Cause of his decrease thirst is that is alpha option, which is vasopressin. Next, 20, if one spin in the chair continuously and the stop suddenly, fast phase of the nystagmus is in the opposite direction of rotation, it is called Charlie post-rotating nystagmus. 21, the voluntary inhibition of the micturition is due to the pudendal nerve. 22, the shortest half-life is of the GnRH. 23, the alpha-adrenergic stimulation causes Charlie the pupillary dilatation. 24, how long a wound takes to attain the maximal tensile strength, that is 3 months period. Next, 25, achalasia due to the defect of Charlie the mentric plexus. 26, a male came with the profuse effortless diarrhea 20 episodes per day. He has the muscle cramps and the dehydration. He gave history of drinking water from the stream. His 2 kids are also suffering. The microscopic comma-shaped organism is seen, that is the Vibrio cholera. Next, 27, after finger cut in the boy, which of the following is initial mediator, that is the histamine. Next, 28, Hauser's membrane from the hypoblast will make boundary of alpha exothalamic cavity. Next, 20, decreased AV nodal conduction velocity presentation on the ECG, that is Charlie increase in the PER interval. Next, 30, most common opportunistic infection after the kidney transplant is Charlie polyoma. Next, 31, a patient is having bleeding problems, PT 14, hepatitis 60, bleeding time 6 minutes and defect in which of the following pathway, that is intrinsic pathway. 32, the patient with the primary amenorrhea, short stature, webbed neck, that is alpha Turner syndrome. 33, the organism which produces the fluorescent pigment and the resistance to the beta-lactam antibiotics, it is the Pseudomonas. Next, 34, the boy had the extraction of the deciduous teeth and now profusely bleeding. Which classical hemophilia factor is missing? That is Charlie factor number 8 minor. Next, 35, the diagnosis of the colon carcinoma mate many years back. CEA was raised that time. Patient came for regular checkup. You advise CEA now. What is the role of CEA? That is for follow-up. 36. The patient present with the subcutaneous bleeding, petechiae and ecchymosis with a coagulation profile and CBC normal diagnosis. It is vasculitis. 37. The patient presents with the abdominal pain with the dysentery. Stool contains pus and ARBs. Causative agent is enterohemorrhagic Escherichia coli. 38. A woman with a history of trauma to the head and neck region, having the lesion on the tongue, on the protrusion of the tongue and deviated to left side. The nerve most likely involved is alpha, which is the left hypoglossal. Next, 39. The person after RTA with a damage the temporal bone, he remains unconscious for 3 minutes. Later on develops the temporal swelling, blurred vision. His right pupil was dilated. Which artery is involved? It is anterior branch of the middle meningeal. Next, 40. PBD tuberculin test done to the patient after 40 hours. 15 mm arrhythma is noted. Cells responsible for the arrhythma are alpha helper T cells. Type 4 hypersensitivity. 41. Which bacteria have no cell wall? That is mycoplasma. Next, 42. In artificial respiration, 60% oxygen given and 40% nitrogen given. After switching off artificial respiration, there is a brief apnea episode due to low arterial oxygen suppressing peripheral chemoreceptors. 43. The patient with the severe headache, vomiting and neck stiffness, raised ICP on the lumbar puncture. There was the blood stand. CSF diagnosis is subarachnoid hemorrhage. 44. The patient came in the ER with the chest pain, ECG normal, cardiac enzymes normal. Doctor advised thoracic cage X-ray. Which one of these structures is the cartilaginous plus amphiarthros joints? Beta, that is the costochondral. 45. A old woman has routine checkup of her health status. She has no chest pain, cough. A chest X-ray shows the peripheral 2.5 cm diameter coin lesion in the right mid-lung field. Which biological characteristic best distinguishing lesion as the neoplasia rather than the granuloma? That is Charlie uncontrolled autonomous growth. 46. Which one is used in the HIV? That is ziduvidine. 47. Antibiotic for the Bacteroides fragilis is the clindamycin. 48. Which portion of upper GI tract has inner circular and outer longitudinal layer of smooth muscle and the skeletal muscle respectively? That is the middle esophagus. 49. Important sign in the eye to the hypertensive arteriosclerosis is delta AV nipping. 45-year-old man with a long history of alcoholism, presence with a severe epigastric pain, nausea, vomiting, fever and an increase in the serum amylase. Diagnosis of acute pancreatitis superimposed on chronic pancreatitis was made in this condition. Which of the following types of necrosis is most characteristic? That is fatty necrosis. 51. The temperature of the set point increase, then there will be decrease in beta sweating. Next, 52. The local lymphatic obstruction is caused by the combination of what two infections? The neoplasia. 53. The gradient between the intracellular extracellular potassium is maintained by the Charlie sodium potassium ATPase pump. 53. The pregnant lady having the mitral stenosis develops arterial fibrillation. Drug given should be beta IV heparin. 54. The tumor suppressor gene involved in the renal and the gonadal agenesis is WT1 alpha. 55. Adult polycystic kidney disease mode of transmission is Charlie autosomal dominant. Next, which is 56. The most common skin cancer in the HIV positive patients is delta Kaposi sarcoma. 57. Sympathetic cholinergic post ganglionic supply is to which of the following? That is beta sweat glands. 58. Is the following supply adrenal medulla alpha greater thoracic splanchnic nerve. Which drug safe in the liver decompensation disease is beta oxazepam. 60. The patient using topical steroid for very long time, he is at the risk of delta, which is osteoporosis and the fracture. 61. The patient with the hyperemesis gravidarum having hypokalemia can present with which of the following? Beta metaboloculosis. 62. Newborn child having ossification center distal under the femur. 63. The patient brought to ER unconscious, the breathing problem, empty bottle of aspirin found. Which one eliminate the aspirin from the body? That is bicarbonate administration. 64. Which of the following is an example of the ligand gated receptors? The beta GABA A. 65. Which of the following will happen on the excitatory synapse? That is beta. Next, 66. The patient with the acute MI, this is shown on the ECG by which of the following? The ST displacement infarcted area. 67. The patient undergoing thyroidectomy at the upper lobe, the nerve likely to be injured in the vicinity of superior thyroid artery is Charlie external laryngeal nerve. 68. The patient has lower respiratory tract infection for the many days on histology. Respiratory tree, which of the following will be damaged? Beta cilias. 69. Albumin cannot pass through cell membrane due to negative charge. 70. Villi after third gestation, blood differentiate into delta, that is the tertiary villi. The patient was having inflammatory bowel disease and the diagnosed acute inflammatory bowel disease. Which of the following is the treatment of acute ulcerative colitis? Alpha IV corticosteroids. 72, the malaria entered to human body as alpha sporozoid. 73, the furunculosis in the tip of the nose spread to cavernous sinus by E superior ophthalmic vein. 74, after chemotherapy tumor size regresses by delta apoptosis. 75, the male presented the OPD with a 104 fever for the last 4 days and given history of using anti-malarial. She has been passing cola-chlorine for the last 1 day, decreased LFTs and increased unconjugated bilirubin. What is the cause? That is alpha G6 PD deficiency. 76, the patient presented with the high-grade fever, rigor, chills for 2 days, 105 pulse, BP 110/80, dark color urine. Likely cause is the cerebral malaria. 77, after RTA blood loss, patient presented with the shock and mean RTA pressure less than 60, which will activate now beta, that is CNS ischemic response. 78, the female patient of the village has developed gum bleeding after delivery, raised PT, APT and the low platelets, neutrophils 2400 bird cells, and seen the peripheral smell in the FDP. Raised diagnosis is likely beta DIC. 79, the fat pad of upper eyelid anterior to alpha levator aponeurosis. Next is 80, that is the Canon A wave is associated with the complete heart block. 81, the obese patient taking oral hypoglycemic developed diarrhea and the metallic taste in the mouth. It is due to the metformin. Next, 82, the carbon dioxide transport in the tissue to the lungs in the form of alpha bicarbonate form. 83, the patient presented with the fatigue, dizziness, low HB, difficulty in breathing, and the diagnosis anemic hypoxia, which is the following statement is true, that is alpha not responsive to oxygen therapy. 84, sodium potassium ATPase activity, it's stimulated by the insulin. Next, vagal of the heart causes beta increase in the PR interval. Next, 86, effect of epinephrine on the heart is Charlie, increased contractility of the heart. Next, 87, the patient presented with the fever, neck stiffness, irritation, diagnosis of bacterial meningitis by Mays, which drug should be used, that is ceftriaxone. 88, the 35-year-old female presented with the skin infertility, fallopian tubes or blocked, endometrium showed a collection of the epithelioid cells, histiocytes and the giant cell, that is tuberculosis infection. Next important thing, 89, the female undergoing the chemotherapy to the CA breast now presented with the difficulty in the swelling. There was some white growth inside esophagus with the pseudo hyphae. Likely reason is alpha candidiasis. 90, the person had traumatic incident of upper limb. For 3 months he feels pain and the tenderness. Swelling developed at the region on the X-ray. Swelling in the is bright. After 1 year it is resolved. The phenomena is Charlie, the metaplasia. 91, the systolic phase of the cardiac cycle correspond to which of the following component of ECG, that is ERT interval. 92, the branch of internal iliac artery that remain the true pelvis is which of the following? Beta, that is the middle rectal artery. 93, 26-year-old male presented to you in the surgical ER after penetrating injury to the right lateral chest on examination. When he inspired, the mediastinum moves to left side and during expiration the shift towards the left side is enhanced. What will be the likely diagnosis? That is Charlie, the tension pneumothorax. 94, the patient has the pruritic rash, raised creatinine with the burning feet and hand, and also having the urine plasma protein. Diagnosis is Charlie. HSP is 95, schistosoma causes which of the following? There is alpha urine bladder infection. 96, tumor of eye with least METs is the Charlie BCC. Next, 97, the woman has joint pain with the photosensitivity and has anti-DS-DNA positive. The pleural and pericardial effusions. Urea is raised more than 66. What is likely mechanism? That is immune complex deposition. 98, what is likely cause of secondary hyperaldosteronism? That is delta renin. Next 99, the patient presented with the Crohn's disease. For her treatment of remission, corticosteroids are given. What is the best for the maintenance of the remission of her disease? Charlie, azathioprine 100. 2 days for ovulation, luteinizing hormone surge is 6 to 10 folds. 101, the plasma protein drugs related to the inactive until activated by the liver. 102, nerve to ligamentum teres capitis is beta obturator. 103, the hypercalcemia leads to which effect on the heart? That is alpha systolic arrest. 104, metropic patient with the presbyopia has Charlie, the decrease near VN. Next, 105, diagnostic test for the infectious mononucleosis is the monospot test. 106, the cross bridges in the skeletal muscles are formed by the myosin. 107, the extension of hip joint is limited by the beta iliofemoral. Next, 108, the peripheral chemoreceptors are stimulated by the Charlie, decreased oxygen. 109, the saliva helps in the digestion and it is secreted by the VIP vasoactive VIP 110, the minor salivary gland nerve supply is Charlie, that is facial. 111, a newborn with the translucent swelling on anterior abdominal wall umbilicus attached to its apex is alpha, that is omphalocele. 112, the Marfan syndrome, gen defect located on which chromosome? 15. 113, investigation for ankylosing spondylitis is delta HLA-DR 27. 114, about sodium cromolyn true is Charlie, the prevent antigen associated with the mast cell degranulation. 115, the poor prognostic factor for the burn patient is alpha DAC. The brachial plexus devian is done by, that is delta, which is the pectoral minor muscle. Next, 117, the 25-year-old patient presented with the complaints of dizziness, shortness of breath, poor discoloration of extremities or 2 days, and the lips and extremities. Noted which investigation should be done, that is the spectroscopic examination of HB. 118, the posterior to the third part of the duodenum is beta inferior vena cava. 119, if superior mesenteric artery blocked, then which part of intestine will be affected, that is delta duodenal jejunal junction to the right splenic flexure of the colon. Next, 120, the infant with a dark color nappy and the homogentisate oxidase deficiency due to Charlie alkaptonuria. 121, the hormone responsible for the glycolysis, gluconeogenesis and the ketogenesis, that is beta, the glucagon. 122, the beta adrenergic causes which are the following effect: alpha, the cardiac acceleration. 123, in the last trimester of pregnancy, which change in the respiratory parameters occur, the decrease FEV into FVC. 124, the high output cardiac failure and the cardiomyopathy occurs in the deficiency of alpha thiamine. 45-year-old male with the mask-like face, resting tremor, this is due to the lean in, that must be beta, that is substantia nigra. Next, 126, which hormone causes the extrahepatic protein catabolism, hepatic protein anabolism, Charlie cortisol. 127, nerve pass between C5 and C6 is beta C6. The 128, the patient after RTA does not need vent support because his respiration is working properly. Where is the lean? Below C5. 129, the ability of the kidneys to excrete concentrated urine will increase if the rate of the blood flow through the medulla and the GFR decrease. 130, the stress in the patient in the hospital is due to delta. What's wrong with me? Medical ethics is linked with the study of the moral aspects of doctors' professional life. Next, 132, the woman presented with the vulvar itching, the pinkish purulent discharge. What is the cause? The trichomonas vaginalis. 133, the patient presented with the paroxysmal fever, chills, and time duration of symptoms appearing was 36 to 48 hours. Ring and the crescent shaped organism involved, that is Plasmodium falciparum. 134, the range of the therapeutic dose related to delta therapeutic window. Next, 135, the histology slide, serous SNS with stratified epithelium in the duct seen in beta lacrima gland. Low grade follicular lymphoma translocation is which of these, that is alpha. Next, 137, patient came in the semi-conscious condition. CSF analysis shows the glucose 20, protein 150, 5% neutrophils and 20% lymphocyte. Diagnosis is the beta partially treated bacterial meningitis. 138, if myelination of axon damage, what will happen? That is Charlie increased resistance is noted in internodes. 139, the arachnoid via dura merged to form the coccygeal ligament at what level? That is S2. 140, complete transaction of the brainstem above the pons would prevent any voluntary holding of the breath. 141, two vertebral arteries joined to form basilar artery. This is called delta convergent. 142, the lateral ventricles are separated by the septum pellucidum. 143, after RTA, patient present with the loss of light touch and the pressure on the left side, no other sensory or the motor loss. Surgeon orders MRI because he is suspecting damage of alpha right sided ventrospinal spinothalamic tract. 144, the direction of nystagmus is vertical when a subject is rotated, that is alpha with the head tipped sideways. Next, 145, the criteria for the diagnosis of the sepsis is Charlie, the positive culture, virulence of the Staph aureus strain measured by the beta, the coagulase positivity. 147, the Weil disease is caused by delta leptospira. 148, the chlamydia is the etiological agent for beta, the bacterial inclusion conjunctivitis. 149, the gas gangrene is the limb is caused by beta clostridium welchi. 150, the rat bite cause fever by the toxin beta streptococcus molaniformans. Function of the lactoferrin is Charlie, that is prevent iron utilization by the bacteria. Next, 152, a 28-year-old woman, basically I am skipping it, a biopsy of the cervix is performed and a microscopic examination shows the CIN3 infection with which of the organism is likely to cause her disease, that is HPV. 153, the myiasis of the nose is caused by Charlie larva of fly. 154, the young girl uses contact lenses present orbit the redness, itching eyes, her cornea is inflamed, her contact lens water sent for the culture. Which organism is cause of her infection, that is acanthamoeba. Drug of choice for the treatment of the diabetic neuropathy, that is beta, which is cobalamin. Next, 157, again this is a lengthy scenario, and the right option is decrease activity of the UDP glucuronide transferase. Next, 158, the new antihypertensive drug going to the test investigate by which technique, that is alpha sequential trial. 159, the main objective for screening test for the cervical cancer is beta early diagnosis and the treatment. Next, 160, effects of mannitol in the CHF beta, it precipitates the pulmonary edema. 161, similarity between the cardiac and skeletal muscle is transfer saturation. 162, resting median potential revert back to normal due to Charlie progressive opening of potassium channels. 163, the common muscle contraction protein for smooth and the skeletal muscle is beta actin. 164, when blood pressure in the carotid sinus decrease, it will cause increase of Charlie the heart rate. 165.9% normal saline means alpha, which is 9 gram in 1000 ml. 166, the minor calyces receive urine from beta renal papillae. 167, hyperexcitability of the neuron is due to the decreased level of delta calcium, which test is done to know the hypothyroidism, that is TSH and free T4. 169, maximum number of beta cells and islets of Langerhans are present in the beta tail of the pancreas. 170, the growth hormone need which hormone for the adequate action, beta insulin. 171, hormone with increased secretion in the dark and causing hypogonadism, there is Charlie melatonin. That's it. Thanks for watching my video. Do subscribe my channel. Till my next video, Allah Hafiz.